Welcome to Time for Health. Today we are looking at cholera, which is a disease that has affected most countries here in Africa and also in Zimbabwe. And we want to look at the definition of cholera and the causes of cholera, the symptoms and ways of prevention the spread of cholera. So let's get started. So when we look at cholera, by definition, it is a bacterial infection caused by Vibrio cholerae, often transmitted through contaminated water and food. So it's often transmitted through contaminated water and food. If you are using contaminated food or water, you get this cholera. So you have to look at the fact that there's a lot of factors that contribute to cholera, whereby looking at poor sanitation, inadequate water treatment, and limited access to clean water. If you have limited access to clean water, you're likely going to suffer from cholera. So let's get deep into this discussion. So let's look at contaminated water. So you know that cholera's bacteria thrive in water contaminated with human feces. This is where it's much more likely to spread. This is where it's actually thrive. The Vibrio cholerae. Lack of access to clean and safe water can lead to the ingestion of contaminated water, initiating the infection. So that's how you get the infection, the cholera infection, by using contaminated water, because this is whereby the contaminated water will lead to the infection of the human being, of which you have seen that from the image is contaminated with the human feces, whereby there's a lack of clean access to safe water. Then we have poor sanitation. So inadequate sanitation facilitates and improper disposal of human waste, contributing to contaminated water sources. So once the water sources are contaminated, that's how we spread cholera. This is how cholera has been caused, because we are looking at the issue of open defecations and improper sewage disposal increase the risk of cholera transmission, because sewage disposal, as you know, is now exposed to everyone. That's what we mean by sewage disposal. And they increase the risk of cholera transmission, because it's always linked, this bacterial infection is always linked with inadequate sanitation, whereby you have access to the disposal of those human feces. The waste is going to end up contaminating the water sources available. Then you will then drink that water. That's how we get cholera. Then we have unhygienic food handling. So when you look at consuming raw or undercooked seafood, particularly shellfish from contaminated waters, can introduce the cholera bacteria into the human digestive system. That's how it enters the digestive system, by eating food that is uncooked and unsafe also. Additionally, we have to look at the fruit and vegetables. Irrigated contaminated water may also pose a risk, because they are already contaminated with the waste which causes cholera, because that's unhygienic food handling, because you're now eating the food that has been irrigated with contaminated water, and that poses a risk for you to get an infection of cholera, because it enters into your digestive system, the cholera bacterium that enters into the human digestive system. Then we have overcrowding living conditions. Living in overcrowded place can also increase the risk of contaminating cholera, because cholera can spread rapidly in densely populated areas where people live in close quarters, because they are living very close together, and in terms of hygiene, there's not going to be good hygiene, but there's going to be poor hygiene practices in such settings, facilitating person-to-person transmission, because you're already living in an overcrowded place, that increases the risk of cholera spreading all over around the place. Then in summary, I want to say that understanding and addressing these factors are crucial for preventing cholera's outbreak, because if you understand that you're not supposed to be overcrowded, you're not supposed to be using contaminated water with human feces and sewage pasting everywhere and being disposed in the water bodies, in water sources that you drink, is going to be very much the cause and the root cause of the cholera bacteria spreading into your human digestive system. So you have to know that these factors are crucial for preventing cholera outbreaks and reducing the impact of the disease, because once you know that these factors are the ones who are contributing to cholera, you know the best way in which you can prevent them. Also, improving water and sanitation infrastructure, promoting hygiene and education, and ensuring clean access to clean water are key components of cholera preventing strategies. That's very important to know that you're supposed to always have to drink clean water. Also, you have to be educated on how best you can have promote hygiene, because hygiene is the one which reduces the spread of cholera. So with this, I thank you.